on this computer. Hey everybody, this is Dr. Paul Thomas with Startup PPC. I'm here in Detroit, Michigan, and I'm joined by a very special guest. I'm talking with Lori Ortiz, Dr. Lori Ortiz, who's practicing in Puerto Rico, and she has set up the very first direct primary care practice in Puerto Rico. So this is going to be an awesome conversation, and I'm really happy to have you here, Lori. Thank you so much for being here.
I'm very excited, and thank you for the opportunity.
Oh, you're welcome. So yeah, let's talk about your practice. You said it was called The Way Primary Care?
The Way Family Clinic.
The Way Family Clinic. That's awesome. Yeah. And when did you launch your practice?
Early January.
Awesome. So you're really just getting started. It's February now, so
baby steps.
That's awesome. Have you had any patients come over into your practice yet?
Yeah, I've had I have a couple of members now. Just signed up a member today, this morning, so I'm very excited about that. I've also seen multiple patients with one-off visits. So they're kind of thinking about it since it's a new model. As you said, it's the first one, the first clinic in Puerto Rico, using the direct primary care model. And so people are kind of like getting used to a new concept. So I'm hoping that those patients will come back because they definitely had a great experience, and they left here with a very good impression.
That's awesome. I love to hear that. And what inspired you to start this? I mean, what inspired you to start this kind of practice where you're at?
Okay, so I've heard multiple stories from different DPC docs. So mine is very similar. I finished residency in 2017 and joined a practice that it was a chronic care management practice. So I wasn't the patient's primary care provider. I was more of a consultant, just helping them get their diabetes or their chronic kidney disease or their hypertension better controlled. And it was a different model. It was like a pilot thing that was going on within the company that hired me. So at the beginning, I only saw like 8 patients, 10 patients, at most 12 patients. So to me, that was wonderful because I was having the time that I needed to make sure the patient understood their treatment and that I had time to just listen to their concerns and address them. That's basically what impacts most the quality of life of the patient, is that they feel heard, and they feel like their concerns are valued, and that they feel part of the treatment that they're going to take. It's not just a doctor telling them to do this or that. So I was fine.
The shared doctor-patient decision-making is so critical.
Right, it is. And but 1 year after, since it was a pilot program, they started to just increasing the number of patients we needed to see. And when I left in December, they're up to about 24, 25 patients. So just like 15 or every 20 minutes, we see a new patient. And with the same typical patient that is very complex because it's a chronic care disease clinic. So I was just having time to ask them, are you okay? Do you need any refills? Okay, next. And that was not the type of medicine that I wanted to practice.
Sure.
So when I saw that, I was like just trying to see what other side hustles I could do as a doctor, because I did not feel happy with the way I was practicing anymore.
Sure.
And I was just asking myself, do I want to stay in medicine, or do I need to, just go look at other stuff people are doing out there? And or maybe early retirement. I had all of these thoughts in my mind until I stumbled upon the direct primary care model. Nobody was doing it here, so I just read it and it sounds nice, but it just stayed there until last year, where COVID kind of like exacerbated a lot of things in the system, and made me see even clearer that I needed to move pronto if I wanted to be a better doctor and practice a different type of medicine. And so since the DPC Summit last year was virtual, I was able to participate not because I'm not able to fly in from Puerto Rico over, but because I was pregnant. I was due in June.
Oh, wow.
And so
Congrats.
I was not going to be able to fly if it was in person. Actually, she was born at the end of June, so the DPC summit was like 2 weeks later. So I had a 2-week-old while I
Wow.
was attending the summit virtually.
That's
And
amazing.
yep. And then just soon after I bought your book, Startup DPC, I gobbled it up in like 2 or 3 days. It was just onward from there. I just got momentum and just told my husband, this is what I'm going to do. So we need to sit as a couple and make a plan because I'm leaving soon.
Yeah,
um,
dude, that's amazing. Thank you for the shout out for the book. I appreciate that.
it's an awesome book for starting, really, and for just inspiring. It's very inspiring. And I also read some
Awesome.
of the books you recommended in your book, so it's been
Oh, yeah.
helpful.
Yeah, there's a ton of great ones. I love, which ones do you read?
I read Start With Why by Simon Sinek. I read
That's a,
Crush It from Gary Vee, which is awesome.
yeah, those are both amazing books, and they're so practical for a physician. You can read those and kind of understand the gist of what they're telling you to do, and it can really help you shape your own branding and marketing outreach. So that's amazing. I'm really glad you picked those up. So yeah, it sounds like you're well on your way. Is there anything I can help you with, or anything I can do for you, or explain to you, or teach you? Or I'm sincerely happy to help.
I think the biggest challenge that I'm having right now is just since basically when you start, you're like a one-man or a one-woman clinic. You're doing everything. So I'm doing also all the marketing and stuff. So just prioritizing what to do. So I have 2 kids at home. I have a 7-month-old and a 2-year-old child. So I'm
Wow.
just trying to balance to not take their time, their family time. Um, by while doing this. So just prioritizing. I was trying to do all of the marketing at the same time, just manage like LinkedIn and I didn't even use Instagram before having the idea of building a DPC clinic, of starting a DPC practice. So I only used Facebook. So now I'm using Facebook, I'm using Instagram. Those are my main. I'm just trying to get my LinkedIn going.
Yeah.
So
I think,
just prioritizing, it's been the biggest challenge, I guess.
yeah, I think every doctor struggles with that, especially in this model. You're always balancing how do I spend my time most effectively? And
Right.
I ask myself that question every single day. So I just want to reassure you that everybody's asking themselves that question. I can see patients, of course. I'm going to probably spend 4 hours of my day, 5 hours of my day seeing patients now that I'm just about full. And then I'll spend 30 minutes working on marketing, 30 minutes paying the bills. But then from there, it's kind of like, okay, do I call a business owner in the community, or do I try to book myself to speak at the local church, or do I try to book myself to speak at the library, or do I, try to write an opinion piece, or do I call the news network? There's like, it's hard to tell what exactly is the best thing. So my best advice is just keep doing it and keep making the calls, keep sending out the press releases, keep writing the opinion pieces for your local paper. And as long as you have that continuous forward momentum, you're going to be unstoppable. Eventually you're going to get full, or eventually you're probably going to get to 250 patients, and you can hire that assistant, and then
I can't wait.
So, yeah, I know.
It's gonna be
That was
awesome.
one of the best days when I had my first doctor join me. That was an awesome day. And then when we hired our medical assistant, that was another just perfect day. That was an awesome part of growing this practice, is starting to be able to delegate some tasks to somebody else.
I have a lot of people I know where I did residency at, which was in the north part of the island. So I'm like 1.5 hours away. And I know a lot of people from there, and they love the model. And I'm like, can't you just, move here and start here? So definitely, if I'm able to expand, I have a lot of people interested in the north side of the island. I practice in the south side.
That's awesome. That is phenomenal. I'm a little bit jealous. I'd love to be in Puerto Rico right now.
I
just
know it's
because,
getting very cold there. One of my
yeah,
best friends is over in Florida. She's not even getting the worst of it, but you know, in comparison to the temperature we have here, she's like, I'm freezing.
yeah. Well, very good. Thank you so much for chatting with me today. I wish you the best of luck in your clinic. I mean, it's super exciting for, to see the direct primary care model work where you're at. And, I'm sure all the DPC doctors are pulling for you and your success. So
Thank
hopefully we
you.
can get this out to a lot of doctors, get you some more patients, and watch you grow and succeed.
Thank you very much, and thanks for all you do with your book, with your blog, with everything you do to keep moving DPC along and just inspiring doctors to do this, because it's a very different kind of medicine for both doctors and patients. It's something to rediscover your love of medicine and what you do and what you study for, which is to take care of patients.
Yeah, I think that's really at the heart of it, just having enough time, building a system where you can have enough time to be compassionate, to answer all your patients' questions, and to, feel like you're giving the best care possible. And I love the DPC model just for that reason. So it's really cool, and it's inspiring to see people like you,
I'm not
taking up this
considering early
torture.
retirement anymore. I can do this for the rest of my life.
Yeah, that's awesome. All right, well, cheers. I think we'll close it there because that's a great thought to leave it on. And thanks again for taking the time to talk with me, Dr. Ortiz.
Thank you.
Oh, you're welcome.